Hi everyone. I know stress and anxiety is pretty high right now, and most of us are feeling a lot of tension in our necks and through the base of our heads, and maybe causing a lot of pain as well as headaches. So, I know most of us, to alleviate pain and tension in this area, we go and see our massage therapists. And obviously, right now we can't do that. So, as a physical therapist, I wanted to share some simple trigger point and myofascial release techniques with you to help you get through this time before we can go back and see our beloved massage therapists, because I know we miss them all. So what you will need is some type of ball that has give to it. I prefer to use tennis balls because they are a little bit squishier and they're not so hard. If you don't have tennis balls, you can use lacrosse balls, or racket balls also work well. What you will also need, and if you have one, that's okay, but if you have two, that would be preferred. If you have a long tube sock or an old pair of tights or nylons, works well, so that you can place the two balls in there together and tie a knot. So when you're doing some of these techniques with the two, it helps them to stay in place. So we're going to start with one ball first. And you're going to take your head and bring your nose towards your left hip and your left armpit. So your head is down at an angle. You're going to take the ball off to the center slightly at the base of your skull and apply pressure with your right hand. And you're going to turn your head kind of up at an angle and down. And then you can also stay in that same position with your head in this direction, and you can rub up and down with the ball and kind of go towards the side and over right behind your ear. A lot of the muscles in our necks and our upper backs attach to this area, which can be a lot of source of tension, headaches that can start here. And you're going to repeat the same thing on the other side. So turning towards the right, angling your head towards your right hip and your right armpit, taking the ball in that position, turning your head up and down, and again massaging all through this area here. Now you're going to take that one ball again, and you're going to place it at the base of your skull in the center and lay back. And we're going to start with a trigger point release. And with trigger point releases, you want to maintain a steady pressure for about 10 to 20 seconds. While you're in this position during the trigger point releases, try to breathe nice and deep and slow. And with each exhale, trying to imagine that tension leaving that area. After the 10 to 20 seconds is up, take the ball out with no pressure and wait about 10 to 20 seconds. This allows the blood flow to rush to the area, which brings necessary nutrients for tissue healing and relaxation. So then you're going to take the ball back into that area, and this is the myofascial technique, which involves some movement and pressure. So you're going to nod ever so gently up and down. And you can do these myofascial techniques for about 1 minute or so, whatever is comfortable for you. Now you're going to take the two balls and place those at the base of the skull, again, on either side of the spine. And just lay back on them. And again, do the trigger point release first, holding for 10 to 20 seconds, breathing through it. Take the balls out, no pressure, wait again about 10 to 20 seconds. Replace those balls back into that area. And again, you're going to nod up and down. It's a very small movement, but it really helps to get those tight muscles at the base of the skull. Those are those suboccipitals that can be a source of where tension headaches start from. Now you're going to bring those balls, the two again, to right about here where those upper traps are. And again, lay back on them, applying pressure, holding for 10 to 20 seconds. Take the balls out, no pressure, again, 10 to 20 seconds to allow that blood to flow to the area. Replace those balls again into the upper trap area, and this time you're going to add some movement for the myofascial release, bringing those arms up overhead. And you can do those about 10 to 20 times. And then you're going to move the balls a little bit further down into this area through here. And again, trigger point release, holding for 10 to 20 seconds in this area. Remove the balls, lay there for about another 10 to 20 seconds without any pressure. Replace those balls back into the area. This time you're going to bring your arms out into like a cactus arm position or field goal arms, letting the chest open up because this tends to get really tight with poor posture and working on our devices and laptops. And bring those arms together and apart, and together and apart. And again, you can do that about 10 to 20 times. And go ahead and take those balls out. And we're gonna need a wall for the next part. So we're gonna place the two balls together. If you only have one, you can just use one in this area. We're gonna place them up on the upper traps again. And lean into them, getting pressure through those upper trap muscles. About 10 to 20 seconds, holding, and then remove the balls without any pressure. Again, wait about 10 to 20 seconds to allow that blood to flow to the area to bring the necessary nutrients for healing and relaxation. And then you're going to add some movement with your arms, again up and down for myofascial release. And then you can take those balls down in between those shoulder blades there. And again, lean into it, applying pressure. Hold for about 10 to 20 seconds for trigger point release. Remove those balls from that area without any pressure for, again, 10 to 20 seconds. Replace them back into that mid-scap region. And you're going to bring those arms into cactus arm position, out and in for myofascial release. The last one we're going to do today is taking the one ball, and we're going to place it behind the shoulder here. And again, trigger point release, holding for 10 to 20 seconds in that area. Remove the ball without any pressure for another 10 to 20 seconds to allow that blood to rush through the area for healing and relaxation. And this time, to get those rotator cuff muscles, we're going to take our arm and bring it hand to the belly and rotate out and in. And again, you can do this movement for about 10 to 20 times for myofascial release in that area. After doing any of these techniques, it's always recommended to do some movement or exercise afterwards to maintain the tissue mobility that you gained while doing all of this. And in general, you want to keep well hydrated and drink lots of water and keep moving. If any of these techniques that I showed you cause more pain or any other problems or more headaches, please reach out to me so that I can help you modify them so that they help you in particular. These aren't meant to cause more pain. They may feel a little uncomfortable, and that's normal as well. I hope this does help you to get through these times when we can't see our beloved massage therapists, and we are all missing them, and hope they're doing well too and staying healthy. And stay tuned. In the next few days, I'll probably be coming out with more myofascial techniques, maybe for the low back and hip region, as well as maybe some education on posture and using better ergonomics for our at-home workstations. Stay well and stay healthy. Thank you.